Hello and welcome once again to the Ask Dr. Pickel show, where we find answers for people who have chronic health conditions, chronic problems. Today, our webinar is basically about the thyroid and thyroid fluctuations and a lot more about the thyroid stuff that you need to know if you have thyroid issues, or even if you don't have thyroid issues. This information would be great. It's not only some expanded things, but also some basics. And if you don't know me, if you're new to us, my name is Dr. Jason Pickel. I'm a functional medicine practitioner. I'm also a board certified chiropractic neurologist. So today I want to dive right in and go into quite a few things. Many of our patients who come in have multiple thyroid symptoms. And they live with these day after day, and a lot of them have been to doctor after doctor after doctor, and they've been through many different treatments, exams, diagnostics, and they just continue to have the symptoms and continue to suffer despite medications, despite different treatments. So the thing is to try to find answers. What's really causing your issue? Because you can get diagnosed with a thyroid problem. You can get diagnosed with hypothyroidism. You can get diagnosed with hyperthyroidism. But what's causing it? Basically, those are symptoms. These diagnoses are symptoms. You have low thyroid function, or you have high thyroid function. Why? Or you have fluctuating thyroid function. Why? So we're going to kind of talk about these things, because those diagnoses really don't tell you what to do about it. They just kind of say, okay, I've got these set of symptoms, and here's something to take to maybe help those symptoms, is what we hear from most patients. So, diving right in, here's some common symptoms of both. There's, in fact, let me move this out of the way here. There is low thyroid symptoms, underactive, or also called hypothyroid symptoms. And there are overactive hyperthyroid symptoms, too much thyroid hormone potentially. So if we look on this side, on the low side, you can read through these, and you have to say, do I have some of these symptoms? You don't have to have all of them. In fact, the majority of people have more. Actually, these lists are kind of short lists. These are just the more common that we'll see with patients. And even on the overactive side, you have some of these. And some people, that have low thyroid, they were like, oh gosh, I wish I had high thyroid because at least I'd get weight loss. Well, no, actually you don't want that, because that's even more dangerous than the low thyroid. So there's different sides. Now, some people have a combination of both of these, overactive and underactive. And we want to talk about what that's all about too, and why you would potentially have both. So let's dive right into the details of all this, because if you do have some of those symptoms, and especially if you have those symptoms and you're taking thyroid medication, and it's like, hey, my doctor prescribed this for me, I'm taking this, I still feel all these symptoms every day, or the majority of them, or some of them, and it just doesn't seem to be getting better. And they keep having to change my dose, or they keep running the labs and it's different, and they keep having to. So we'll go into that also, and then why this can occur. So let's go ahead and dive right in here. All right. So I think first it's important to get kind of a foundation to understand a little more about thyroid hormones. Let's get some basics here. Where does it all start? Where does thyroid function start in the body? So first, it starts in the brain, and actually an area in the brain called the hypothalamus. Okay, so this area in the brain, very important. This is the area in the brain that regulates all of your hormones in your body. Every single hormone, this is the guy who does it, girl who does it in the brain. Not only regulates hormones, but regulates body temperature, appetite. It affects emotions, actually quite a few things. The hypothalamus, pretty important area of the brain, and important that it also gets feedback from the body to tell it what's going on. So that hypothalamus sends out a signaler called TRH, thyroid releasing hormone. So this TRH gets sent down to the next person in the line here, called your pituitary gland. And you've all probably heard of the pituitary gland. It's also in the brain area. It sits right below that hypothalamus. And this is where these hormone signalers are released. Hormones are made there, they're released there. The main one that has to do with the thyroid, though, and you usually, if you have a thyroid issue, you've heard of this, it's called TSH. Oops. That. Okay, got rid of too much. All right, so TSH. So what does TSH mean? Thyroid stimulating hormone. This is the hormone that goes from your brain to your thyroid that says make more or make less. So it's going to be the signaler to either increase or decrease, which of course it's being signaled by this, increase or decrease. All right, so then we get to the thyroid actually. Let's get a better picture here. Remember, the thyroid kind of looks like a butterfly. All right, so we've got our thyroid gland. All right, so the thyroid gland does a few things here. The thyroid gland plays a part in maintenance of bone density in a big way too. But we're not going to get into that today. We're going to get in how's the thyroid affect my thyroid hormones, which is the main thing it does. It makes two things. It makes T4 and it makes a little bit of T3. Now, the thing you got to understand here is the thyroid mainly makes T4. In fact, about 90 to 97% of what the thyroid makes is T4. And really only 3 to 10% is T3. So really it's pretty minimal on the T3 side. And the thing is T4, the thing you have to understand with T4 is inactive, meaning T4 really doesn't do a lot. It has some functions, but it really doesn't do a lot. As far as your metabolism, it doesn't do a lot. What does it eventually have to do? It has to turn into T3. There's a progression here. We got to go through a progression. Okay, so the thing is if you go to your doctor and he runs a blood test on you, the typical blood test they're going to look at is they're going to look at this TSH, and they're going to look at T4. Actually, the one they'll usually look at if you're taking thyroid medication is called free T4. I just wrote an FT4 there. So, because the free T4 actually will measure the synthetic medication, whereas the T4 doesn't measure that. It really measures your natural thyroid hormone that your body makes. So, they're mainly looking at that TSH, T4, and they're going to say, hey, is that TSH high? Is it up? Is TSH high? If it is, that means your brain is screaming at your thyroid, make more hormone. If it's low, if TSH is low, then that's your brain saying to your thyroid, don't make much. We've got plenty. In fact, we've got too much. Cut or slow production. So if your doctor sees that, if he says, hey, TSH is high, that means usually that T4 is low. So then your doctor will usually prescribe some T4. He's going to say, hey, he or she's going to say, hey, here's some Synthroid, here's some levothyroxine. These are synthetic T4 medications. And if they see that your TSH, again, is low, they're going to say, hey, let's take away some medication because we're probably giving you too much. So either of those scenarios can exist, and this is typically what they look at, and it's really the management of that. Now, the problem comes in is when you feel lousy and you're still having thyroid hormones and you go to your doctor and he's like looking at this and he says, hey, you're taking too much thyroid medication, your TSH is low, and you say, but you know what? I feel like I don't have enough thyroid medication. I actually feel lousy. I feel like I have all the low thyroid symptoms. And I say, well, your lab doesn't show that. I'm going to lower your dose, or we'll keep it the same and we'll retest it here after a bit. So, and this can become a round and round thing, because the thing is if you experience low thyroid symptoms and your lab test looks normal or the opposite of what you feel, then we've got to look at other things. We can't just look at that and say, okay, if she keeps complaining about this or he keeps complaining about this, the next time he comes in or she comes in, my next step is going to be to give them an antidepressant or an anti-anxiety medication, because the thyroid hormone should be doing the trick. Obviously, we're getting fluctuations, but the only tool in that doctor's toolbox of conventional medicine is usually thyroid hormone. So what else are they going to do for you? All right. So the thing is we've got to look deeper. We've got to say, hey, is there more to this than your TSH number and your T4 number? And there absolutely is. We got to look outside the box, not really outside the box. We got to look in normal physiology. We got to look at the whole thing. Your thyroid connects to everything. Your thyroid hormones affect everything in your body. It's not like your thyroid just lives on an island by itself in the middle of your body there and it's not connected and it doesn't talk to anything else. It all communicates. So we got to look at the whole thing here. All right. So we go down to these hormones. And let's get back to kind of the basics here. So mainly this T4 is the big thing that's made here. Now that T4 has to turn into T3. All right. Now where does that occur? It primarily occurs in two areas in the body: the liver and the intestines. All right. So liver and intestines, two main areas. Now, here's the interesting thing. About 60% of your T4 turns into T3 in the liver. About 20% turns into from T4 into T3 in your intestines. There's a remaining 10% there. That goes into different areas of the body. It's pretty minimal amounts, but these are the bigger areas. So this is where we have to focus on the most, especially the liver. So if you have a liver problem, if you have an intestinal problem, if you have gut dysbiosis, if you have leaky gut, if you have an intestinal infection, if you have some type of bowel issue, malabsorption, this isn't going to happen. If the gut's inflamed, you're going to lower that 20% to who knows how much lower. If your liver's inflamed, liver, very important, big detoxifier, has a lot of effects on hormones, blood sugar, so many things. The liver does a lot of jobs, and this is just another job that it has to do. So if you bog it down, what's going to happen? You even lower that 60% down. So now you are putting out a lot less thyroid hormone. So that's going to decrease your conversion. We call this conversion of T4 to T3. All right. So if you have problems with this, then you're going to decrease conversion and now less T3. Now T3 does a few things. Once we have this T3, where does it go? All right, that T3 ends up going to your cells. Okay, so what happens is that T3 travels in your bloodstream. It gets in a taxi cab called a binding globulin. You don't have to remember that. And then it travels to the cells of your body where it has to dock. Think of like a space shuttle docking on the space station. Well, what happens with this is this hormone has to dock on what's called a receptor on your cell. It's like a doorway. And then it has to bind there, and then that causes a proteogenomic response, and then you get the thyroid hormone actually helps the cell to make energy, to make ATP. So we get this whole effect there, which affects your metabolism. So all of this has to go smoothly, this whole pathway. And there's also some other things that can interrupt it too. Now, another thing about this too is what if we have inflammation in the body? If there's inflammation in the body, that can affect your receptors. So now the T3 can't really dock very well. Also, kind of interesting, If you have too much T3 in your system, that will shut down the receptors. Too much hormone is just as bad as not enough. Some people actually take take T3, whether it be synthetic or natural. Synthetic would be like a Cytomel prescription, and sometimes the T3 level can rise, and if T3 gets too high, basically the cell says that's too much. There's too much out there. Close the door, shut down the receptors, and now you don't get any in the cell. Where the inside of the cell is saying, hey, I need more thyroid hormone, we're getting low thyroid symptoms, the guards at the door are saying, sorry guys, too much out there, it'll flood the cell, we got problems. And then you can actually experience low thyroid symptoms, even though you're taking tons of hormone. So this can also happen. And there's actually a few other reasons too. Now, let's go back through this, because again, the important thing here through this is we're getting this all the way from the brain, all the way down to a cellular level, and all these steps that can occur. So in conventional medicine, if I'm just looking at, hey, is there TSH low or high? Is T4 low or high? Am I missing something? If the patient says, hey, I'm feeling lousy. I get so many patients that come in here and they'll say, hey, I feel like my endocrinologist, I feel like my doctor doesn't listen to me. I tell them I feel lousy. They keep not changing my hormone, or they keep taking some away, or they keep adjusting it over and over, and I'm not feeling better. So that's why we've got to look at this whole picture here and say, where is the missing puzzle piece? Because it's a lot more complex than what it was seen. In fact, let's even add a little more complexity to this, because what is the brain? What stimulates the brain, this hypothalamus area, to one of the things that helps it to make this TRH, to get the whole thing started. There's actually two important things here. One of them is serotonin, and one of them is dopamine. Serotonin and dopamine are neurotransmitters in the brain. Serotonin, if you're low on serotonin, you could feel down, you could feel depressed, you could feel like crying, hopeless. This is your typical depression with crying. Dopamine, that can make you feel irritable, everybody leave me alone, I really don't feel motivated. There's actually a whole list of symptoms on both of these neurotransmitters that we won't go over here. But if either of these neurotransmitters is off, the whole thing can't start in the first place. So if you already have a depression problem, is that going to cause a thyroid problem? Potentially. So we've got to look at that too. Now, what can affect these guys? What can make them not be able to be produced? Well, there's a few things. Blood sugar issues. And that's not just diabetes. That can be high blood sugar, low blood sugar, like hypoglycemia. Anemias. These can be iron deficiencies. These can be B vitamin deficiencies, especially B12 and B9. Now, B9 is folate. Those are probably the two big ones that go into that, and methylation. So if you also have a genetic issue called MTHFR, or a B12 genetic issue called MTRR, then you can have a further problem there. And another thing that can affect this too is inflammation once again, because inflammation can block the whole signaling to these guys in the first place with brain inflammation, and then the whole thing doesn't work at all. So again, this whole cascade of events can occur which can affect your thyroid hormone. Now, when you take T4, again, it's still, when you take your synthetic thyroid hormone, your natural thyroid hormone, if it's mainly T4, what's going to happen is that T4 has to come into the puzzle here, and it still has to turn into T3. Now, some of your natural thyroid hormones will have T3 in them. Some of your synthetics are a T3. So you can bypass some of this, but again, you never know exactly how much your body needs. So then that can affect the cell in a bad way too. The thing is you can add hormone. There is the hormone replacement theory. And that means if your hormones are low, you should add more. Well, some people need more because their body just can't do it. There's been too much destruction, something has occurred, and they just can't do it. So the thing is, though, is to find out, hey, is there a way that you can help your body to either make it on its own? Is there something that's blocking it or affecting it, that's affecting your ability to make it on its own? Or is there something affecting this whole cascade of things that's occurring that's affecting the ability to just make all that in a different direction too? So we've got to look at all these different factors when we look at this. And the thing is any of these steps along the way can create problems. And there's in fact another one here. When we transport these thyroid hormones, when they get into the taxi cab that carries the thyroid hormones called globulins, these taxi cabs can be affected by high estrogen levels. And even in men, actually, even high testosterone levels, but especially high estrogen levels. And estrogens come from things in our environment. They come from foods. Women sometimes have estrogen dominance. We also have to look at that too to say, hey, is that affecting the thyroid hormones here? So there's all these different possibilities that can affect this, that can cause thyroid symptoms, thyroid problems. And it's just finding out what's at the bottom of this. What can we do to change this picture to help you to be able to get the thyroid hormones from point A to point B properly? All right. So then we've got to say, hey, wait a second here. What if I have low thyroid symptoms and high thyroid symptoms? What if I have both? Because mainly what we were talking about there will produce low thyroid symptoms. And if you have hypothyroidism or low thyroid, yeah, if you have clinical hypothyroidism and you take thyroid hormone and you feel better, and as long as you take it, you're good, then you have hypothyroidism. You have classical primary hypothyroidism. You're good. Your doctor will love you because you're a textbook case and you're not a troublemaker. I hate to say that. All right. But if you're a troublemaker, if you keep complaining and again, you keep saying, hey, I don't feel good. You keep adjusting this. You keep checking my labs. I'm not feeling good. Then we've got to look even further, because we can look at all those things we just looked at, but there's another issue at hand here, another thing that can cause even more problem. And this is more common than all of this. And that is called Hashimoto's thyroiditis. All right. So Hashimoto's. If you have Hashimoto's, there's ways to test for this. And that's the thing, is a lot of people have never been tested for this, or if they've been tested for it, they've never been told they had it. So, and your doctor will run an antibody test on your blood test, usually what are called TPO antibodies and thyroglobulin antibodies. There's two different types of main antibodies that you can look at to verify, do I have Hashimoto's or do I not? Now, the thing is too, is there's ranges that go along with that. So I'll talk about that here in a minute. But here's the important part to understand, is if you have Hashimoto's, this is an autoimmune condition. What's auto mean? Auto means self, and it means my immune system is attacking me. My immune system has lost tolerance for me. Does this equal a thyroid condition? No. Meaning that if you have Hashimoto's thyroiditis, yeah, there's a potential for a thyroid problem, but the thyroid isn't the cause of the problem. The thyroid isn't the cause. The immune system is the main factor here. And the problem is in conventional medicine, there's no way to deal with this. There's no way to deal with Hashimoto's except to give a person more or less thyroid hormone. Now, with autoimmune conditions as a whole, from a conventional medical standpoint, if you have, let's say, like lupus or MS or ulcerative colitis, if it gets to a certain point, the doctor will prescribe a steroid, or they'll prescribe a biological drug, something to suppress your immune system. So if your immune system is attacking your thyroid, hey, let's just get rid of the immune system. Now, did that help the cause of the problem? No. In fact, does that open the door to other bad guys? If you look at the side effect list, or even if you watch those commercials, one of the first symptoms they'll say is possible death due to infection. What kind of life is that? So the side effects of these drugs are a lot more harsh than what you're feeling. So that's why doctors aren't going to use these, especially with Hashimoto's, because they could do more damage than good. So especially with Hashimoto's. So the thing is we can't look at just the thyroid. Yeah, if your thyroid's been damaged because your immune system has attacked it day after day, we do have to say, hey, wait a second, can the thyroid even make enough hormone now? Do we need to add some hormone in? Yeah, maybe so. But is that going to solve the problem? No. What do we got to do? We have to address the immune system. What is the immune system trying to do here? It's thought with autoimmunity, the immune system's just willy-nilly attacking your thyroid. Well, yeah, can that happen? Can we get some loss of self-tolerance? Potentially, it's a theory. Is there potentially something in your thyroid that your body can't get rid of that keeps it attacking it? A heavy metal, a chemical, something in your system that your body just can't get rid of? Big possibility there too, and that's more of what we look for. So the thing is we've got to say, hey, how can we get this immune system under control? How can we get rid of what it's attacking? Or if it's just attacking you for no reason, how can we calm it down? What can we do to the body to get the immune system more under control? And that's really one of the big keys with Hashimoto's. Now, another thing to understand with Hashimoto's is it causes this, meaning every autoimmune condition, it's textbook, they cause symptoms that wax and wane, meaning flare up, remission, ups and downs. So if my immune system is attacking my thyroid, one day I could release excess hormone into my system. Suddenly I have high thyroid symptoms. Oh gosh, I'm feeling anxiety. I'm feeling like my heart's racing and beating through my chest. And then the next day you could wake up and it's, gosh, today I feel so lethargic. I feel like I can barely get out of bed. I'm totally constipated today. So again, you can get this variableness in your symptoms there, these ups and downs. Now, not only will it occur with your symptoms, but where else will this occur? Your TSH number. So if your doctor looks at your TSH and every time they test your blood for your TSH, and one day it's high, one day it's low, one day it's high, one day it's low, every time I go in, that's a different number. That's pretty characteristic of Hashimoto's. You got to really start to think that. And the problem is these people get stuck in this road to nowhere where they're basically adjusting their thyroid medication all the time. If you're getting your thyroid medication adjusted a lot and frequently, big chance Hashimoto's is the issue. Bigger chance that your immune system is the issue. And also it's important to know when you have one autoimmune condition, rarely do you have one. You usually have more than one. It's called polyautoimmunity. So this is kind of the takeaway with all of this. All right. So again, just remember Hashimoto's at the core of a lot of these issues. Let me just fix that there and go back to this. All right. So knowing this information, now you can say, hey, maybe I need to look at some other things. Maybe I need to get some blood tests to look at these other areas. What's my T4 look like? My T3, my free T4, my free T3, my T3 uptake, my thyroid binding globulins. Do I have positive thyroid antibodies? How's my liver function test? How's my gut function? How's my brain and neurotransmitter function? Do I have any deficiencies of B vitamins? Do I have any genetic issues? Do I have any, iron deficiencies? How's my blood sugar? So we've got to look at, again, this whole cascade of things that can create this type of a problem. And this is what we do day in and day out. So I hope this information helped. I really enjoyed this. And two, let's see here if there's anybody with some comments here. Maybe I can address these on the end. Someone saying they were diagnosed with Hashimoto's, then celiacs about 9 years after that, also MTHFR. Yes, and this is what we see. We see this so commonly. Usually when there's one autoimmune condition, there's more than one. And Hashimoto's has a whole cascade of issues that go with it, which again, commonly food intolerances, B vitamin deficiencies, all these other things. It just ties into so much. So I'm glad you're watching there, and hopefully this information helps. Have a wonderful day and God bless, and I'll catch you on the other side. Also, a quick shout out to my daughter. It's her birthday today. So happy birthday, Audrey.